So behind this one sheet here is our treatment planning form. On each form, you can see we have a number from 1 to 32. We have the type of treatment that we're going to do, the surfaces that we're going to use. Also, when our tooth is missing, let's say number 1 is missing, you're going to put a mark right through here, and that way each tooth, let's say for example that is missing, you're just going to put this through. Also, when doing the initial examination, we're going to say what treatment is recommended. So from this point over, this is all recommended treatment at the point in time, and then when you finish it, you'll use this portion of it right here. Groupings are going to be, let's say for example, this patient had a need for MO, she needed a filling on tooth MO, and let's say DO, and let's say ML, just for the heck of it. In treatment planning this, we might recommend that you do tooth number 2 and number 4 in the same group. So you might say group number 1 here, and if they have a number of other different fillings in the front, you might make this all group 2. If not that one, but if they had that way you lump things together in quadrants if you can do that. The person doing the examination, any posterior teeth can either have an amalgam if you feel comfortable doing an amalgam, or you can do it in composite, whatever makes you as a clinician more comfortable with that. So whether it's that if the tooth is not restorable, all you're going to do is you're going to just check that mark off, and perio would be the same thing there. Endodontics, right now currently we're really not doing posterior endodontics, very limited anterior endodontics, but if you see that someone needs a root canal with a tooth that can be saved with a composite, you would just go ahead and check whichever that area would be. Okay, so that's during the treatment planning. You're going to fill the patient's name out here, the exam date, and then that way this will be all linked together. When making your next appointments, you're going to use this treatment planning with the previous dentist who recommended by the group numbers that they recommended. And so hopefully we as clinicians will have the same mindset on how to do things. Materials might vary, whether it's composite or amalgam in the posterior, but pretty much hopefully have the same type of mindset. When during the date of service, let's say I were to do amalgams on tooth number 2 and 4, so we would just go to amalgams on tooth 2 and 4, then you would put the day's date today here, you would put your name would be here, and then the initials of the clinician would be here. So when we look at treatment that needed to be done, when it's completed, it'll have a finish date, the name, and the initials of the provider. It'll be there. Then, not only be there, then it will be also put into the progress notes here with the details of what was done. So next visits, once again, you would have a routing slip on the front of it for the next appointment, and then that would just be filled out properly. You know, just taking good records is important because it's important to do good record keeping, just because we want to make sure that we're consistent in our communication with our patients, with each other, and so that it continues to give Trinity Community Care a real valued, within our community itself, and so we look like we're organized, because we will be organized.